14 years ago, I was on my way home from an industry event. We were sitting at a red light and we were rear-ended. You know, you don't know when something's going to happen that's going to impact you so badly. I really didn't feel that I wanted to go to a chiropractor. That first day when I went in and Dr. Steiman walked in the door, I had a horrible night. I was in terrible pain. And I said, well, I really have no hope that this is going to do anything for me. But I was told that you're like a god and I'm going to be here. And he said, without even hesitation, he goes, well, I really don't think I can live up to that statement, but let me see if I can help you.
I think he embodies passion. I think that he embodies empathy. When we're treating a patient or have any interaction with the patient, he'll come in the room and you can see immediately the patients light up. When they see him, they have such a respect for him and they have this comfortability where they can ask him any question that they have.
Dr. Steiman was one of our first chiropractors who raised his hand when the opportunity arose for St. Mike's Family Health Team to be the first centers to have a chiropractic team on site as part of the family health team structure. And our mandate here at the Family Health Team has been to serve our inner city health population within the downtown east corridor. And what Dr. Steiman had also seen as well was that patients that were experiencing musculoskeletal pain or low back pain didn't have access to the resources that would actually be able to help them. And that comes from his interest in serving this population and wanting to make sure that for a service that's not OHIP covered currently, that patients would have access to an opportunity that would actually improve the quality of their lives.
It's very innovative, and it was the first of its time that chiropractors were working clinically in a hospital. It was identified by the Ministry of Health in Ontario as a best practice model for Ontario, as integrating musculoskeletal providers within funded primary care. We are also recognized nationally by the Healthcare Innovation Working Group for the federal government and by the WHO. Oh, Igor would say it wasn't him. He would right away say it wasn't him, but it was him.
We all collaborated. It was really a grassroots type of movement. They perceived the need. We delivered back in 2004 when we started, and I saw the potential here. I urged them to try and set up a prospective study, seeing how collaboration between medicine and chiropractic changed, and I think it has.
And so I think that's one of the things that makes him such a tremendous asset to creating that environment of inclusivity, and he does it in the most humblest of ways. Certainly, I think that's one of the things that's made us have that personality that we have here right now.
He's been involved in research ever since he graduated, so he's been involved in numerous research projects that he's led, also supervising students.
His mentorship has been vital in my learning, and I think that being here at St. Michael's Hospital, working with other healthcare providers, it's really all about managing patients to give their patients the best possible care that they can receive.
Working with students is gratifying, especially when you see that over the course of the 6 months that they spend with me, they are evolving, and that I have been able to give them some information or some guidance in terms of improving them so that they'll be better healthcare practitioners when they graduate.
It all drills down to that desire to improve quality of lives of people, not just within our practice or who we're seeing in clinic, but just the general public.
So, you know, it kind of expanded into even more than just a me thing. It's a whole family thing. Our whole family has been treated. You know, when you have a doctor like Dr. Steiman on your side, he's giving you the tools to stay well.
I get more fulfillment from patients who keep themselves well after I've been able to teach them and treat them to help them get there. And staying away from practice, it's a poor business model, I know, but that is probably what I get most enthusiastic about. In terms of my legacy, I'm hopeful for CMCC remaining a chiropractic college that prioritizes patient care and training interns or students of chiropractic to be as good at it as possible, therefore be accepted by anybody who's scientifically based and reasonable into the circle of care for all patients, because there's definitely a need. Our waiting list here shows there's a need. We want our profession to continue to excel at that.
really wish him all the best, but congratulate him on this really important award.
I'm speaking on behalf of myself and all of the interns that you have helped and mentored over the years. This is well deserved.
Congratulations.
Thank you for all you've done for me and my family.